Do I have OCD, and what are the signs and symptoms that I have OCD? Hi, I'm Clara and I'm an associate licensed marriage family therapist and embracing therapy, and today I'm going to talk to you a little bit about the misunderstanding of OCD and the symptom that you might have that might be a telltale sign that you have OCD. Mental health disorders still get a lot of stigma, but OCD is one that specifically gets misunderstood. For example, we hear people saying, I'm so OCD, my house is so clean, and this perpetuates the idea that OCD is good and makes people feel like they need to be shameful of maybe these behaviors or thoughts. Do I have OCD? That's a great question. And you might, if you're asking that, you might want to know how OCD manifests and some of the subtypes so you have a better understanding about what this disorder looks like and how you might be able to seek help and treatment. Obsessive-Compulsive Disorder is a mental health disorder characterized by recurring, intrusive thoughts, usually obsessive, that bring up a bunch of negative emotions such as anxiety, distress, fear. And in response to these intolerable emotions, a person will engage in repeated patterns or behaviors, also known as compulsions, to try to comfort themselves in these moments of distress. Individuals falsely believe that completing these compulsions will somehow make these thoughts disappear and make these thoughts not come true. These obsessions and compulsions can severely impact with daily functioning and affect work, life, relationships, and that is when it's a time that you might need to seek therapy. Okay, so you have OCD, now what? Here are 3 things that you can do. Firstly, you can seek professional help. Therapy is a great place to start. The first line of treatment is completing a CBT-based approach, which is using ERP, exposure response prevention, where a therapist will lead you through understanding what your intrusive thoughts are and how we can complete exposure therapy to help you sit with the uncertainty and discomfort of these thoughts and address the compulsions. You can find therapists that specifically specialize in OCD through nocd.com, or you can find a therapist here at Embracing Therapy. Mindfulness and relaxation techniques are great and incredibly important to, again, help you learn to sit with the discomfort of your thoughts. If you have OCD, these thoughts are intrusive and they are distressing, like they are persistent, and therefore you might be feeling distracted and uncomfortable in your everyday life. It's important to practice deep breathing, finding places that make you feel calm to help you find some moments of peace within these moments that you're trying to work on your OCD and become comfortable in this uncertainty and discomfort. And lastly, build a support network, social, friends, connections, share what's going on with you, and make sure you are being supported during this time. I hope this helps.